Hi, welcome to the Contra Costa County and Tri-Valley Eldercare channel. My name is Stephanie. I'm the marketing director for Horizon Elder Law, as well as today's host for the Eldercare channel. Today we're here talking with Paula Silvermano and Susan Anderson with Sutter Care at Home to learn more about Sutter Care at Home as a company, as well as geriatric care management. Can you tell our viewers a little bit more about yourselves briefly?
I would love to, being the shy person that I am. I've been with Sutter Care at Home, the private care division, for 8 years now. I came, or maybe 9, I came a year after Susan did. We started as a very small care management company and grew within a few years to also involve non-medical home care. What we found is that our geriatric care managers were finding more and more of a need for home care, non-medical, and so we added that to our service line. 2 years later, after I had been there, to my surprise, Sutter acquired us. I had been with Sutter 12 years previously, and then I had gone to Cohen Cormier. So it was a bit of a surprise, but I will say it has been wonderful to be part of a larger organization where we have many more resources. I'm trained as a health educator, but I feel like everything we do is education and outreach. And so I'm really excited to be here with you today doing some education with people. Thanks.
Thank you. And Susan, can you tell us a little bit about your background?
I never expected to be in geriatrics. I started out in the drug and alcohol field, and while I was working on grad school, I needed a research project, and I was looking at the differences between our seniors and our younger patients that came through rehab, and I ended up doing a research project on this. And the next thing I knew, I was in California, and I was in the geriatric field for good. I've been doing this for 25 years. I have worked as a care manager for a professional conservatorship agency. I helped create a care management program, and then I went to the predecessor of Sutter Care at Home. In 2011, I took the national exam. I am a certified geriatric care manager.
Wonderful. Thanks for sharing. What types of services now? You do non-medical home care and then geriatric care management. What does that entail?
I can talk about the non-medical, and if you wanted to, as the geriatric care manager here, non-medical is basically support with activities of daily living. So what that means is if somebody needs help showering, shopping, light housekeeping, just personal care, we are there to provide that for them. Our non-medical division is a little bit different from other agencies because we do have geriatric care management, and Susan will talk a little bit about that. But all of the caregivers that work for us, and this is really important, all of our caregivers are employees of Sutter Health. They're benefited and they go through the same trainings that we do. We are a team and we very much appreciate the additional resources to be able to provide our caregivers with what they need to do their jobs best. And there's care management.
Many years ago, I had a reporter following me around for a day, and he described me as a professional granddaughter. And I kind of liked that. Okay, it's been a few years, so maybe professional daughter. But I am a professional daughter. When I come in, I provide the professional expertise looking at what a family member might need, maybe doing an assessment, finding resources, coordinating resources, all of those kind of oversight things that maybe a family member would have done maybe a little slower because they don't know what's out there. And I also provide the oversight for our caregivers. I will create a care plan for our patient. I monitor that care plan. I may do special training with a caregiver if there is something in particular, maybe dementia or mental illness that we're dealing with. And sometimes I do the things that family members can't do. Take somebody to a doctor's office. I had a client where I was the one that every month had to come in and do the flea medication on the cat's neck because she couldn't catch him. So we step in and do all those things that we need to keep somebody at home to keep them independent and to make sure they have the right care.
That's excellent. So, give me an example of what a care plan might look like for just pick a random person.
Well, first of all, we'd look at what the person's diagnosis was. Do they have dementia? So, say it's a dementia client, we're looking at safety issues. Are they a wanderer? Do we need locks on the doors? Do we need a motion sensor light because they may not remember to turn the light on when they get up at night? Do we allow them to keep large amounts of cash? Do we find a bill payer? What do we need our caregiver to do? Make sure that they've taken their medication, make sure they take a shower, change their clothes, make sure the dirty clothes get washed and not put back in the closet. Get them some socialization, maybe take them to a senior center, get them some exercise, take them walking, go to the dog park, all those kind of things. Something that, you would want mom or dad to be doing if they could do it on their own.
Great. That definitely answers that question. Thank you. What do you do better or different than other geriatric care management companies?
I think one thing that we have is the experience and the qualified staff. A lot of agencies will send an office person out to do what we call an intake. They'll take all the information, bring it back, and then they send a caregiver out. As a care manager, I'm one of the ones that goes out. I'm looking at that client. I'm looking where their deficits are. I'm looking what they need. I'm asking them about themselves so that when my caregiver comes in, she knows this is somebody that knits. I might find a caregiver that's interested in knitting, so they can do something together. But we definitely have the professional experience to figure out what's needed, not just a salesperson.
And let me just add that I think what's really important too is that caregivers are amazing and they have huge responsibilities. And our model, that's one of the reasons I think Sutter was interested in us, our model of having geriatric care managers providing the oversight to the caregivers is very important. We think that in terms of quality and best outcomes, that's the way it should be done, and that is our commitment.
I agree. And I think to add to that, what I've heard before is that you actually will just show up randomly on your caregivers.
Saturday and Sunday mornings, I show up with muffins. Hi, I was in the neighborhood. And I think it's important because we have families that are trusting us to take care of their mother or their father. And I don't want my people slacking off. I don't want to hear that somebody's spending the day on the phone or somebody isn't doing what they're supposed to. And so,
not that that ever happens,
well,
of course.
And sometimes we're told the caregiver is doing nothing. And I come in and find the house is now immaculate. The refrigerator's clean. There's meals for 4 days that they're not there. And it's like, who's doing this? Well, she does nothing. So we try very hard to make our clients feel safe, to make them feel like they're getting their money's worth, and to make them comfortable.
That's great. So what areas do you cover?
We cover currently, private care covers Alameda, Contra Costa, and Marin counties. So currently that's where we're providing our services. Sutter Care at Home is a full service agency that serves all of Northern California. And we were the last service line to be added to truly complete their continuum of care. And so we're really proud of that as well. We will continue to grow and to expand into areas outside of those counties, but for now that's where we are.
Excellent. And how many geriatric care managers are in your office?
4.
Okay. And how many non-medical caregivers are there?
Close to 100.
Wonderful.
We usually have about 100 at any given time.
And then my next question is, what kind of background checks do you offer with your caregivers?
No, we really want our clients to feel comfortable because the reality is this is an intruder in their home, no matter how nice they are. So we do a criminal background check. We also do reference checks. For some of our caregivers working in facilities, we have what's called live scan, and a great majority of our caregivers are live scan, means they're also fingerprinted. And our caregivers all have to have a clean driving record. They all get drug tested. We do TB testing. We give them flu shots. The goal is to keep the client safe.
Wonderful. And you are obviously licensed, insured, all of those things. You cover workers' comp in case somebody gets injured. And why would that be important?
Well, a lot of people don't realize that you need workers' comp, and if you have a private caregiver in your home and she falls down and hurts her back, you may end up paying some hefty medical bills. The other thing is, if you have somebody and you haven't been able to check out who they really are, you don't know if they have a criminal background. You could find yourself as a senior being preyed upon. There's all kinds of financial abuse that goes on, thefts. You're dealing with a frail and sometimes compromised population.
That's great information. Thank you so much. Do you have anything else that you wanted to add?
I just wanted to say that as part of Sutter, we are a not-for-profit, and so we do a lot of work in the community. And that's another thing that really adds, I think, pleasure to our jobs and meaning to our jobs, because we're out there, we're providing charity care sometimes, or we're providing patient assistance where they wouldn't be able to afford it otherwise. And being part of Sutter, a larger organization, allows us to do that.
Well, that's great. So how do you get funding for those?
Through our foundation.
Okay.
We have a foundation through Sutter Health, so that's how it's.
That's wonderful. I didn't know that. Thanks for sharing.
You're welcome.
Anything else?
One thing I'd like to say is it always makes me feel good when someone calls and says, I always feel better talking to you. You sound like you understand. Every single person that works in our office has either dealt with caring for a family member or they're still doing it. So I know what it feels like when you're guilty because you haven't been able to afford to fly across the country and see mom every month, or when your kids are sick and you can't take dad to the doctor and you put him in a cab, or when they call and say, you'll never believe what happened. I've experienced it either professionally or personally. So, we can really be empathetic because we know where they're coming from.
And that was a draw for me, I think, is that I was dealing with my own mom who was struggling with aging in place. And when I moved her to the Bay Area, I depended on Susan at times to go out and see my mom because as the adult child, as the daughter, I wasn't always listened to, and it was very tough. And so knowing that I had backup was really important to me, and it got me through some really tough times.
That's amazing. Great. That's a great testimony right there. With that, can you tell us how an adult child might see the need for your services?
I think the most common thing is when an adult child is at a distance. We will often get calls saying, I don't know what's going on. I come out, mom looks okay, but I keep hearing stories from the neighbors. So we can be the eyes on the ground. The other thing is I get a lot of families that will call me and say, we're starting to notice little things. We want to have a family meeting and we need a resource. You're it. And I will sit down with them, maybe even the adult children and the parents, and we'll go through all the what if situations. What if mom dies first? What if mom has to go in a nursing home? What if dad breaks a hip and is in skilled nursing for a while and mom is alone? What do you do next? Do you have legal arrangements made? Has anybody talked about funeral arrangements, or are you going to wait till they're in the ICU? These are the things that it's hard for people to bring up. And sometimes they can say, we've got a professional and it's all her idea.
That's great. Well, thank you so much for your time.
Thank you.
It's been a pleasure learning more about Sutter Health at Home. If you would like more information for yourself or a loved one, you can find all of their contact information on the Eldercare channel, including a link to their website as well as their phone number, or you can contact them directly at 510-536-3377. Thanks for watching, and we hope you have a wonderful day.